Welcome back to Mom in Mind. I'm your host, Dr. Kat, and on today's episode, I'm joined by Dr. Sarah Oreck. She is a Columbia University trained psychiatrist with fellowship in reproductive psychiatry and co-founder and CEO of Mavida Health. She was driven by a deep frustration within the shortcomings in maternal mental health care, so she envisioned Mavida Health as a platform to revolutionize access to high-quality mental health services throughout the path to motherhood. She is a practicing therapist and prescriber and combines cutting edge medical treatments with holistic, whole body approach to mental health. She's the daughter of South American immigrants and grew up between Los Angeles and Colombia, currently living in Los Angeles with her husband and 3 children. And we are diving into what Mavida Health is and why it's so necessary. And not only that, the support that Mavida Health provides, but we also dig into just what it's like to be a mom right now during uncertain times and how Mavida Health is stepping in to fill some of those gaps and filling in to be there for parents in need. Maternal mental health services have come a long way, and this is one of those examples. Being able to have accessible care that people can get to more easily, more readily, is really, really important. And Mavida Health is one of those organizations doing this important work. So let's dive in and talk with Dr. Sarah Oreck. Welcome back, Dr. Oreck.
I'm so glad to be here. I was just reflecting on the last time we had a conversation like this, and I think I only had one child, or maybe I was going to have a baby,
I don't know
but
if you had any
now I
yet.
have three.
Yeah, you've been
Yeah,
busy.
maybe not. Maybe not. Yeah, maybe not. That's
I
so,
feel like it
yeah,
was
exactly.
maybe even like 21. I have to look back. But
Yes. Yeah,
anyhow,
no,
you've
because I
been very
remember
busy.
I recorded it in a closet. Yes, yes. I remember that closet I recorded it in, and I lived there during the pandemic, right before having my baby.
Yeah, that that feels like a lifetime ago. Yeah. So you have been really busy since then, and you've founded Mavida Health, which is an amazing service and platform. And I'd love for you to tell everybody what it is and what you do.
Yeah, absolutely. So I am a reproductive psychiatrist and therapist, had been in private practice for a long time. When we met, that's what I was doing, and I absolutely loved it. But I was able to see a few patients, or not as many as a whole organization with tons of therapists and prescribers. So I'm one person. And certainly, when you're on your own in private practice, it's really hard to take insurance. You don't get the best rates, and mental health, of course, is undervalued still. And it makes it hard to be an in network provider. But I understand that people want in network care. They pay for health insurance already, and they want to be able to get their money's worth. And so I would get so many emails and pleas of how can I get this type of care? And there's some academic institutions that give it, but the wait times are extraordinary. And
Right.
let's say you're postpartum and really struggling, you can't wait 6 weeks, 3 months for an appointment. Like
No.
that's just not okay.
Right.
And so, I did education on Instagram and other social platforms, and I thought that would be enough if people were just armed with the education. But the most common messages I would get is, "This is great. How can I get this care?"
Hmm.
And of course, I wanted to multiply myself. And so I decided to create Mavida Health because I understood that there is this need, though convincing investors was not so easy.
Right.
But I knew that I wanted to scale myself as a specialized prescriber and therapist so that more people could do this, more people could be trained to do this. So at Mavida Health, we train all of our specialists so
Nice.
they know exactly what to do. So basically, they do what I do.
Hmm.
All of my years of residency and everything I've done after in private practice is sort of transmitted to them in some ways. And I wanted to make it a network and scale it up. So we provide prescription. So we provide medication management, individual therapy, group therapy, couples and family therapy. Um, and all of this is available in California, New York, and New Jersey. And we are
Nice.
in network with Aetna, Cigna, and most Blue Cross Blue Shield programs. And I know this isn't everything yet, but it's certainly creating a dent, which
Yes.
we're really thrilled about. And like I said, all of our prescribers and therapists are trained in the Mavida method, so you get really consistent care.
Hmm.
I'm so excited by digital healthcare and digital
Yeah.
mental health, and it's kind of exploding. But often on those bigger platforms, you can get a really good therapist if you're lucky,
Hmm.
and you can get one that isn't so great because
Hmm.
there's no internal consistency.
Right.
And so that's really different for us. Like all of our providers, again, we know what kind of therapy they're doing, and it's consistent between one of our therapists or our other therapists. So you don't sort of get a good therapist sometimes. Like everyone is very consistent, which is so exciting because that quality of care, I think, sometimes is missing in these larger platforms.
Absolutely, it is. Let alone such a specialized
Right.
care with
Right.
deep, deep knowledge, and understanding too.
Yes, yes, absolutely. And I should say it's for the entire path to parenthood. It's from the moment that a seed is planted that you want to be a parent. So this can be if you're
Hmm.
freezing your eggs, for example, is that when that moment kind of starts with, hey, I want to be a parent.
Hmm.
We guide you through all of that. If you're having fertility struggles, which we're seeing increasing more people using assisted reproductive technologies like IVF and IUI,
Hmm.
as well as pregnancy. Pregnancy loss is a big one, as well as postpartum. And pregnancy loss is very near and dear to my co founder and my's heart. We both had second trimester losses.
Hmm.
And even as a reproductive psychiatrist,
Right.
I had a hard time finding that specialized care that I needed. I had sort
Yes.
of a general therapist, and I was like, for this, I really want someone who knows exactly
Right.
what this journey is like, what this experience is like. And I was like, I can't find someone. How the heck is everyone else doing it? And
Yeah.
that really, I think, galvanized this idea of like, I have to do this.
And I'm so glad you did because this is, uh, there aren't that many uh, companies, organizations that do such highly needed and highly specialized care with the right training and the right
Yes.
heading and for the right reasons.
Right,
But
and I love what Postpartum Support International has done, but, like, not everyone has the time or the resources to be able to invest, right, in their own career in that way, and
mhm,
so we take on people who are, like, fully licensed, of course, but have this interest and kind of give them those tools. But I was also kind of shocked, as I was coming up. I have a fellowship in reproductive psychiatry or women's health, but these official fellowships are only in about 15 programs in the US, and they're reserved for medical doctors. Or if you're,
mhm.
a PhD and you happen to do this as your specialty, but that's really limited and
Wow.
and
Yeah.
kind of doesn't take into account that we have nurse practitioners and master's
Yes.
level clinicians that are doing the bulk of this care.
Uh, absolutely. Uh, um, so I don't know. I mean, correct me if I'm wrong. I don't know that there is a platform like yours that includes reproductive psychiatry at this level
Yeah,
also.
no, I think it's really unheard of. And most of the reproductive psychiatrists are either in academic centers
Mhm.
and very costly if they're in private practices. So we are really able to democratize this kind of care for
Mhm.
people that need it. And I think the prescribing part is particularly challenging. There is so much. OBGYNs have a lot of training. They have to learn a lot. They're
Mhm. Mhm.
gynecologists and obstetricians,
Yes, yes.
and the mental health literature is something that many of them have not caught up with. And so
Right.
they'll tell you you can only take sertraline during pregnancy. This is not the case.
Right.
Every medication has a risk versus risk analysis,
Mhm.
and this is very nuanced. And all of our prescribers are very well versed in telling you all those risks and making a decision that's best for you and your family, that's aligned with your values.
Mhm.
And that includes everything from depression, anxiety, trauma, but also ADHD. Or you may have an existing diagnosis of bipolar disorder, like things that impacts the maternal journey is so much more than depression and anxiety, but that's what we
Yes.
typically talk about. But ADHD doesn't go away. Sometimes
Right.
it gets worse.
Right. Right. For
Right, and
sure.
still needs to be acknowledged,
Mhm.
as well as those other kind of more complicated journeys, like if you have a substance use disorder,
Mhm.
or you, again, a pre-existing diagnosis of bipolar disorder, for example, and we can help with all of those. We don't limit ourselves to depression or anxiety.
That's amazing. And obviously everything is done online.
Yes, it's all virtual care, which is really exciting. I think some people have some concern around it, but increasing, we have so many studies that demonstrate the outcomes are very consistent with in person care. I was actually doing remote and telehealth before the pandemic. People think it's like really a post pandemic thing,
Right.
but I was doing it before COVID-19 in
Mhm.
this population because guess what? When you have a million pediatric appointments, when
Yeah.
you have so many, let's say you're doing IVF, you're going to see your doctor constantly.
Mhm.
The last thing you want to do is go to another appointment. And especially, you know this, I
Mhm.
had my private practice in Los Angeles, and driving across town is sometimes long distance. So they were
Right.
like, I'm not going to drive an hour for an hour appointment, right? That becomes a
Right.
3 hour ordeal.
Right.
And so it was incredibly supportive. And we have found consistently that it is. And we also have an app as part of our program, which is really exciting. And I kind of say we have evidence based content that's on our app. And what's really exciting, it's almost like physical therapy. You
Mm.
do things with our therapist during your sessions. And then outside of session, you can practice those skills through content that we deliver to you and that makes sense and is sort of tailored to your particular experience. So it's if you have the time or the space, kind of like that old school cognitive behavioral therapy of
Mhm.
like you do the assignments, but they're
Mhm.
not on a piece of paper on a workbook. They're
Right.
in your phone, in your app, kind of like with how you're consuming information and in the modern day. I just remember all of those, worksheets that I would do, and you would see patients do it in the waiting room right before your session. It's like, no, no, you can just use your phone and kind of do it in a modern way. And then we also have community support, which is really exciting, where we have community chats on all sorts of different topics. So you can see that there's other people that are struggling with the same thing. Of course, peer
Mm.
support is something that's so important
Mhm.
in this
Mhm.
space. That you're not alone. We all kind of go through, of course, this matrescence, this
Mhm.
transformation to motherhood. But of
Mhm.
course, there's some bumps along the way for many of us.
Yeah, absolutely. I love that I mean, it does a lot of things to have it online, but the accessibility
Yes.
is another benefit. Obviously, like you're checking off all kinds of boxes for accessibility. I mean,
Yes. I mean,
making
we were concerned about, if you happen to be near the big fancy academic center where they have this kind of service, great. But if you live in a rural area or if you live hours away, like that
Mhm.
becomes hard to sustain.
Mhm. Oh, right, absolutely. And I mean, I think also adds to feelings of isolation and
Yes.
hopelessness and
Yes.
all of that. It's like
I think, yeah, absolutely.
you're not gonna be able to to spend hours and hours in the car or move somewhere closer just to get this support. And then at some point, if you try and you have a mismatch in provider or whatever, it's real easy to give up trying.
Yeah, no, absolutely. And I think the other great aspect of it that people don't realize is that our therapists gain a lot of insight when they see you in your home,
Hmm.
in your environment. And
Hmm.
we have a BYOB policy, which is bring your own baby before they're verbal. We think it's
Hmm.
absolutely appropriate. And we do a little training on dyadic therapy. So all of our therapists and prescribers are aware of how much information they can gain from those interactions, but also how they
Yes.
can help you understand, oh, baby seems like he needs something from you. Baby is looking at you, right?
Hmm.
And really forming that attachment or increasing that attachment, especially when there's difficulty in that relationship.
Absolutely. And I think another benefit is, well, we know there's still a lot of stigma to
Yes.
seeking therapy. And so
Yes.
even like sometime for some people walking into a therapist's office or anywhere where it's labeled, let alone for certain types of, shall I say, pregnancy related care.
Yes,
or loss related care
100%.
is hard for people to walk into some of those places.
That's so true, and I think we take it for granted living in cities where mental health is more accepted, but
Hmm.
when you're in a small town and you know that that's the one therapist office, that can be really tough, right? When you know all your neighbors, when you know, and there's so much shame and stigma with, I should be so happy. I'm pregnant. I'm having a baby. Why am I struggling so much?
Hmm.
The privacy of having this care in your own home is just, I think, incredible. And I think we see it in our patients all the time,
Yeah.
especially outside of big cities.
Right, absolutely. And outside of the app itself, what other types of, like, I guess, community-based type supports are you providing for people?
Yeah, so certainly one is the community in our app, which is all of these chats about breastfeeding or nights, how to make all of those things work. And we have an expert moderating all of these chats, which is really exciting because I love mom Facebook groups, but sometimes they run wild with misinformation. So it's
That is
nice
true.
to, right? It's nice to kind of have someone who has an expertise to like say, hey, this is actually what we see as evidence based, et cetera. So that feels like really nice guardrails. And certainly that's what I would like when I'm asking someone about breastfeeding or in a group about breastfeeding. I want to hear some of the data and the facts, but I also love hearing people's own personal anecdotes of what's worked and not.
Hmm.
We also do a lot of in real life activations, which is exciting, where we get to go out into the community and meet the moms. We've done a couple of like park hangouts, which is really
Nice.
exciting with some kind of mom influencers. And that has been fantastic. We actually have one coming up in San Diego for
Mm.
any of your listeners down there. And so would love to post the details on the show notes.
Yeah, absolutely. I mean, community is such a huge part of this
Yes.
in so many ways, and also having access. You were mentioning before, access to like statistics, but also just data.
Yes.
People having information that is supportive to their process wherever they are in their reproductive time frame.
Exactly, but it's so hard because when you look at Google and or Google Scholar and you are not someone who's ever looked at a research study, it can be really hard to break that information down.
Hmm.
And
Hmm.
in some ways, we have like one of our first hires, Dr. Blisky is someone who is a PhD, who's like dedicated to this, who's done studies before, and can really help us break it down into lay terms so you understand the facts. And in this world of misinformation, where it's just like rampant, I think
Yeah.
it's a really great thing to go back to the basics, but also have that help in digesting that information.
And what do you see, if you know, like what do you see people are asking for? Like what kind of information are people wanting?
I mean, I think generally people are so confused about the safety of medications during pregnancy and lactation.
Right.
And so that's a huge one that we talk about. Everything from antidepressants like selective serotonin reuptake inhibitors, but for people who have more complex issues like ADHD, for example, or have bipolar disorder, these are pretty complex questions.
Hmm.
And we're able to, again, break down that information, digest it for you, and then help you make a decision that's values aligned with you and your family and what your needs are. And in some ways, that's what physicians were trained to do. But we've gone so far sometimes of like, here's the data, you decide. And it's like, no, as an expert, we're meant to like not tell you what to do, right? Like
Right.
paternalistic medicine is a thing of the past.
Right.
Like stop smoking or you'll die does not work. But I
Right.
can tell you, hey, here are the risks to smoking. Here are some alternatives. Here's how I can help you.
Hmm.
You help me decide with you what's best for you.
Hmm.
And so similarly, that's what we do with medications, which I think again is going to be the antidote to all of this misinformation, things growing rampant. I mean, this is the case with vaccinations. Um, I was
Yeah.
pretty shocked. My pediatrician's like, here are the options. Do you want to do it or not? And I was like, is
Mm.
that how it works? Tell me more.
Uh-uh.
Tell me how
Mm.
to process this information. Luckily, I'm a physician who can, and I'm like, oh, I'm going to stick to the normal CDC schedule for, or the, schedule for immunizations for my children, and that makes sense for me. But I do think that we need to help people break down information, again, not to make decisions for them,
Right.
but to be able to say, here's what I think based on what I know about you. And this is
Mhm.
what I think makes most sense. Do you have questions? Can I help you understand anything that maybe you're confused about?
I think this is incredibly important for so many reasons, but one that is popping up pretty strongly for me right now is how I see social media has turned into this kind of alarmist place with people who, if I can say so, don't have expertise or
Yes.
degrees, stating very emphatically
Yes.
things that make it sound like they are facts and or um, scare you
Yes.
enough into believing them that just that alone makes things very confusing. Like how do you know
I know
at
it's
some
really
point now, how
hard.
do you
It's
know
like,
who to listen
I
to?
know. And it's like the nuance is missing. And I
Mhm,
agree of like, this is my opinion, but here are the facts to back it up.
mhm,
It's a really scary time, I think, to be a parent
mhm,
because there's so many confusing, like you said, opinions that are being passed as fact.
mhm,
Um, and it's concerning for a lot of different reasons.
mhm,
But one of which is public health works, right?
mhm.
We live longer than we used to. We don't have 10 children like our great grandparents because they thought most of them
Right,
wouldn't survive past 5 years old,
right,
right? That is the reason that you had so many kids because
right.
your expectation was quite low that many would make it.
Yep,
And now our kids do. And
yep.
I'm frankly devastated by, the cases of measles popping up in Texas.
Oh, right. Yeah.
Things that we had figured out where public health has actually been incredible.
Mm,
AIDS is
yeah.
a great example.
Right,
Antiretrovirals work.
right,
That's why we don't talk, that's why AIDS isn't like what it was in the 80s and 90s. People forget,
right.
right?
Yep,
It wasn't
yep.
the scariest thing that happened in healthcare for a very long time,
Yeah,
and the
right.
stigma and the shame. And now, if you're a mom who has HIV, you take antiretrovirals and you don't pass it to your baby.
Right.
I mean, it's incredible.
Yeah.
And I think that's been forgotten. Sure, ARVs have some side effects that are challenging, but they're
Mhm.
certainly not worse than having HIV or AIDS. That's actually why I became a doctor, is why this is so something that's so passionate for me. Is my uncle actually had AIDS. He lived with us, and I was little then. It's probably some of my first memories. I was 4 and 5 years old, and he was right at that brink, right before antiretrovirals. He was actually in a study at USC,
Mm,
but it was too late for him. He
mm.
passed away when I was 5, but um, he was like on the cusp of ARVs working and being
Yikes.
as effective as they are.
Mhm,
And
mhm,
so it is deeply saddening to see how we've turned on public health measures that have really worked.
mhm, mm. Oh, right, right. And like speaking of CDC, as you were mentioning before, um, unfortunately, in this moment in time, there isn't data available on that website for people who want to, and very specifically for pregnant and postpartum folks who need that information and need updated stuff. I mean, how do people get that?
There are some websites that are like capturing all of that information, and some of it actually pertains to physicians and how they figure out the schedule for immunization. I mean, this is like really important for patients, for physicians, for providers at large. And there are some websites, I don't have them off the top of my head, but we can include in the show notes, that are kind of compiling all that data that used to exist and bringing it back.
Mm,
So they
mhm,
are
mhm,
accessible, just sadly not through the CDC.
mhm. Oh, right. So this is information that any new data that comes out that would help inform how you
Absolutely,
care
but
for
it's
patients.
also guidelines. So
Uh,
vaccination
oh,
guidelines
okay, okay,
and
right,
recommendations.
right, right.
I think there's other things on there like when one should get a mammogram and a pap smear, and all of these things that are important for women's care that
Hmm,
physicians and providers follow.
hmm.
Right, guidelines on mammograms and when they should start and all of those things.
So yeah, living in the LA area and people living all over the world these days
Yes.
with natural disasters happening. How are you and Mavida supporting people through times like this?
Yes. So I was personally impacted by the Palisades fire. My community is gone. Life as I know it is completely changed.
Hmm.
And it was really challenging. But as I'm sort of in it, I realize that uncertainty is always there, no
Hmm.
matter what, right? These, I think, times of crisis really exacerbate it and kind of bring it to the forefront. But even with the political regime change and what that's been, and sort of all of the media cycle that just doesn't seem to stop,
Hmm.
crisis, trauma, grief,
Right.
I think is prevalent and present for all parents right now. And so we understand that, and part of our messaging is trying to help people really check in and come back to themselves in the present,
Hmm.
because truly that's where we live.
Yeah.
And
Yeah.
there's only so much we have control over, but some of it is kind of admitting that we can't control what happens in the Supreme Court or on that CDC website. But
Right.
what can I do in my daily life to certainly advocate for what's important to me, but also to kind of connect with my loved ones, which is ultimately what life is all about.
Right.
And so we're doing that in our content. I think a lot of people that are seeking therapy right now, it's about a lot of these issues:
Hmm. Yeah.
stress around climate change, right? Climate
Yep.
change disasters. How do I talk to my kids about this?
Yeah.
And we provide all those tools in addition to actually doing, we run a free support group open to everyone, not just people on the parenthood journey, on Wednesdays at 12 p.m. Pacific time. It started out as a fire support group, but it's really
Mm.
for all people that are dealing with so much uncertainty and upheaval at this time.
Right. Which, I mean, it feels like it's just new things or however you want to call it are popping up all of
Yes.
the time. And
And I think
I,
that's purposeful in some ways, right? Like, I
yeah.
think there's a strategy here, um, in some of the people in politics to kind of overwhelm us with
Hmm.
all of this and to
Yeah.
distract us from the things, from what our Surgeon General, our past Surgeon General, communicated about parents, for example, that being a parent in America increases your stress levels, that parents are overwhelmed
Yep.
and overburdened because childcare is inaccessible, because women's reproductive rights are on the line,
Right.
because food prices are going up
Oh, right. And probably are going to go up
more.
more here
Right, right,
very
exactly.
soon.
Very
Uh,
soon.
right. I mean, I think somewhere along the line, I don't know exactly how it's separated out that, like, therapy is only for talking about, your feelings, or it's become it, like, the idea of it is so oversimplified, but people are affected by life, and life is happening in very big ways
Yes.
right now. And it's not, I've heard in some circles that, like, therapy shouldn't be political, or it's not political or something, but, like, I mean, we are affected by stuff happening in our everyday lives, and
Yes.
I think it's important for um, people to have space to talk about those
Yeah.
things with
And
therapists
and
who can hold that space.
and politics has gotten personal,
Hmm.
right? When you have a political party that's telling us that politicians should be deciding women's health and not the women themselves and their physicians,
Hmm.
you made it personal.
Right. And these are real fears. I mean, I have had people, clients, who are going through IVF, who are uh, either potentially going to be pregnant or are pregnant, who have to travel to other states for their work and are worried that if they miscarry in that state, that
Yes.
they harm will come to them because of it.
Yes. And I can't say as a physician that it won't.
Right.
I can't tell you, I mean, even if you're not doing IVF and you're just trying to conceive,
Oh, right. Yes.
right?
Yes.
And
Yeah.
then you travel to Texas and you end up having an ectopic pregnancy, I
Hmm.
am very frightened for you.
Right. Yeah.
and women are dying.
Hmm. Hmm. Right.
Completely preventable, but physicians are also scared.
But yes. Yeah.
And for
We're
our
in a
hands to
bind.
be,
Yeah.
on a bind, and for us to have to make decisions that are not based on the evidence
Hmm.
or on the patient that's in front of us is
Hmm.
is really frightening.
Hmm. Well, I think it's even more important for places like what you're doing with Mavida to exist, to support people throughout from, preconception through postpartum, because this is now, it's always been wrought, but very wrought now,
Yes,
and confusing. And people really need a safe place to go where they know that
absolutely.
whatever they're dealing with is going to be treated gently and with
Yes.
respect. And um,
But these policies, everything that's happening has a real world implication. And I can't tell
mm,
you how much our incoming kind of new patients and even existing ones at Mavida Health and my private practice are all about. I'm concerned about what's happening. I'm concerned about, right, even if I'm not pregnant, the
yeah,
potential of wanting children and what that
mhm,
means for my
mhm,
safety, for my health, all of these different things. And
right.
I think we know having a child in this country is hard enough,
Yes. Yeah.
right? Forcing people that due to their value system or their life stage aren't ready for that
Hmm. Hmm.
is just horrifying.
Right. Right. So through, I mean, as I understand it, as we're talking about it, Mavida is a place that is welcoming
Yes.
to people who
Yes,
are
and I
in that struggle.
100%. And I should say we have clinical care in California, New York, and New Jersey, but our app, which includes our evidence-based content as well as our community features, are available nationwide.
Ooh, that's great. I didn't like think about that for some reason. That, of
Yes.
course, I mean, as long as you're not prescribing or doing
Right.
therapy, of
And
course.
we are looking to expand into other states,
Hmm. Hmm.
particularly one that's having, that we've mentioned several times in the podcast, that's having some challenges of their own.
Hmm.
So we're thrilled to be able to help and sort of reach across to those states that are really struggling from the impact of some of these policies.
So, how did you come to the name Mavita, and what does that mean for you? What does that mean for the organization?
This is great because it starts off with I'm an immigrant. I'm a child of immigrants. So I was born in this country, but my parents were not, which I think is really important at this time. I'm Colombian, so I'm a proud Latina. And the name comes from maternal, so that's mama, and vida, which is life. So
Mm,
maternal life, in when you translate it, is the
mm,
name, and it is really a product. It's my fourth child, I say, and it really is a product of knowing that this was needed in the world and that I didn't see it before.
mhm.
And that my co founder is also a mother, also had a second trimester loss. Most of our employees are parents who have themselves experienced some kind of PMAD. And we are just really dedicated to doing what I think has been hard, even in academic and sort of the public sphere,
Mm,
of moving forward research in women's health. I mean, we
mhm.
didn't talk about this, but we do a lot of research data collection, but we actually tell you what we're doing. So
Mm,
we say we do all these surveys and we tell you what the responses are. We tell
nice.
you what we learned from them. And once you do that, you realize that clients, patients actually want to do them because they want to know, what does this mean? How am I changing? How is therapy working?
Great.
And so, in a lot of ways, we're doing work that we haven't seen researched or published out there of
Mhm.
like, I want UCAT to come in the door one day. And I know from your initial assessment what kind of treatment would be best for you, what kind of therapy, what kind of medications, without having to do all of the trial and error which exists in mental health. So it's really
Yeah.
called personalized medicine for mental health and for women's mental health. But as you know, the research in women's health from all different types of aspects is so limited.
Yeah.
And so we're
Exactly.
really trying to contribute to that. And frankly, we saw the pullback of federal funding, then the reinstatement. But I'm afraid that women's health research is really going to suffer for the next 4 years. And
Mm.
it seems to me like the private sector and companies like ours can kind of push the ball forward until we have an administration that's really supportive of the needs of women.
Well, thanks for doing that. And that's so sad.
I know.
Uh,
I know.
Oof.
I'm wondering what all those, those like the Women's Health Research Initiative and those grants, like,
Hmm.
I wonder if they're just going to get frozen or 'cause they were just awarded.
Well, yeah. I mean, I don't have all the information right now, but I know there's a lot of grant fund freezing happening right now for anything that has to do with what they're calling gender ideology, which I
Right,
believe
right.
also includes
Exactly.
women.
Yep, yep. And so that is very disturbing. And we haven't even talked about like, transgender rights and all
Right,
the people that are frankly so scared.
right, right. So, I mean, all the more reason for for Mavida to be moving forward to
Yes.
gain insights and support.
I'm also going to do more about this, but I have citizenship in this country because I was born here.
Uh,
This birthright citizenship. So I joke with my company is like, is that going to be taken away?
wow, it's terrifying to think, right? I don't know. I mean,
I know.
it's so sad that we
It's so
have to say
wild.
I don't know to
I
some of this
don't know.
stuff.
I don't know. Right.
Um, and it's also so important for Mavida organizations that have anything to do with perinatal health and mental health to be doing everything that they can
Keep
at this
pushing
point.
forward. I agree.
Hmm.
And thank you for talking about this. I just think as providers, like it's just beyond staying silent. This isn't about just trade and tariff. Like this is hitting
Yes.
home.
Yeah. There's unfortunately no neutral anymore.
No, there just can't be. When women's lives are at stake, when people are dying because of these, like I think that's for me when it was like
Uh-huh.
this there's no silence here.
Right, right. Yeah. And so, unfortunately, conversations that used to just be like, these are conversations we have, are now like courageous conversations,
Yeah, it's
brave
so wild,
conversations.
right?
Like,
Like this isn't an estate tax conversation. You know what I mean? Like, and it's so funny that the
yeah,
people that are like obsessed with estate tax, it's like you're not gonna, that's not gonna be relevant for you or your
uh-huh,
family. But it's
uh-huh,
like that's a great example of like, yeah, that's not my lane. But like now everything, right? Gun
mm,
safety is my lane
right,
because that is a real issue and stress for parents in this country that
right.
I have to think about dropping
Mhm,
off my kids and that there could be a school shooting
mhm,
is just
mhm.
absolutely outrageous.
Right. Yeah, I agree. Yeah, everything is our lane now because
Yeah.
it's life. It's affecting people's lives and affecting people's sense of safety,
Yes.
which
Their
is
livelihood.
absolutely impacts their mental health.
And that's what, yeah. And therapy sometimes is about those bigger existential threats.
Yeah. Yeah.
And it's not just about interpersonal relationships.
No. No. There's a lot going on so many levels. And I mean, certainly when we're talking about natural disasters, and there are lots of places where people are impacted by that, where just like your fundamentals for survival,
Are kicked off. Yeah.
yeah, like
That's right.
thinking about eating at your favorite restaurant is not what's on your mind. It's like, how am I going to get food? Period.
Yes. Yes.
Um,
I mean, eggs is such an interesting thing. But anyway, it became such a part of the like,
oh, the
and I was
eggs.
like, eggs are so expensive
They
now.
are.
And I
They
think
are.
because avian flu, there's also just none,
Oh yeah. Multiple times I've gone to the store
like
and
no
there were
eggs.
no eggs.
Yeah.
And I went to Trader
Or
Joe's.
$10 eggs.
Yeah, yeah. There was like one package of eggs left and I got them and I was like, "Oh, is somebody going to try and take them from my cart?"
You're like
Like
looking at the other person like those are my eggs. I know
like, but I like you
it's
can have
really
them. I don't care. I don't want to
I
fight about
know
eggs.
we're laughing, but
It's
it's
not
not
funny.
funny.
It's not. Here, it's where we are though. Uh, well, anyways, I'm super impressed by and grateful really for the work that you're doing with Mavita. And I'm like big old parentheses, hope other, you know,
We're so
um,
impressed by you, and I have to say my co-founder and I loved the episode with Alanis Morissette.
Oh, that was pretty
You're
crazy,
like, we were
right?
geeking out. That was like my first CD, my first
Oh.
everything. Like, I loved that album so much.
Yeah,
That
yeah,
first
me
one.
too. Leading up to that and afterwards, it was like on repeat all
You're
the
just
time.
like, pinch me, pinch me. That's so cool. That's
Yeah, it was
awesome.
pretty cool. Anyways, thanks for taking your
Of
time to be
course.
here,
Of
and I wish
course.
the best for you and your
Thank
family
you.
and for
Thank you.
Mavida
Thank
also.
you so much. Thank
Yeah.
you.
Yeah.
Bye.
You can find Dr. Oreck and her team at mavidahealth.com. And if you head on over to Instagram, you can search up at Mavida Health and at Sarah Oreck MD. While you're there, be sure to hop on over to Mom in Mind and give us a follow as well. We're happy to have you on this journey with us, the work that Dr. Oreck is doing and the work that all the people in perinatal mental health are doing. We need you. We need you to listen, and we need you to share these messages. We need your help to let people know that these services exist and these resources exist, because it's great for us to be here doing these things. But if people don't know we're here, then we're not making the impact that we need to and can make. Thank you so much for listening in. Until next time.